Hello, today is Monday, October 5th, 2020. Today I'm going to be talking about MISC and MISA, Multisystem Inflammatory Syndrome in children, and the new syndrome that's been recently described in adults. I'm going to review the key features and talk about prevention. But let's first start off with MISC, Multisystem Inflammatory Syndrome in children. It's a condition where different body parts can become inflamed, including the heart, lungs, kidneys, brain, skin, eyes, and gastrointestinal organs. The symptoms of MISC include fever, abdominal pain, vomiting, diarrhea, neck pain, rash, redness like bloodshot of the eyes, feeling extremely tired. Now, again, it's believed to be a severe and life-threatening complication of infection with the COVID-19 virus, that's SARS-CoV-2. It was first described earlier this year in April and May when children who were not previously known to have COVID-19 or felt to have a very mild case started showing up in emergency rooms severely ill. Now, this is an emergency, and if your child, parents, is showing any signs of this disease, they need to see a doctor right away. Other concerning signs include trouble breathing, children saying they have pain or pressure in their chest that won't go away, confusion, inability to stay awake or to wake up, bluish lips, or discoloration of the mouth, and severe abdominal pain. Again, medical experts do not know yet what causes multi-system inflammatory syndrome in children. However, many children with this have had the virus that causes COVID-19 or been around someone who has had COVID-19. Now I'm going to talk about this multisystem inflammatory syndrome in adults. This is so new, folks. The medical experts are still working on understanding this and defining this. But here's a summary of what was published last week in the CDC's journal. So far, the age seems to be older than 21 to 50 years. Most of these patients with this have had no underlying conditions, but some have had obesity, diabetes, hypertension, and obstructive sleep apnea. The working case definition, again, this is so new, they're still trying to define this. MISA, this multi-system inflammatory syndrome in adults, includes the following 5 criteria. Now, this is clinical. 1 is a severe illness requiring hospitalization in a person that is 21 years of age and older. The second criteria is a positive test result for current or previous COVID-19 infection. And that's through a test, an antibody test or antigen test in the previous 12 weeks. The third criteria is severe dysfunction of 1 or more extrapulmonary organ systems. That means it doesn't involve the lungs. And that can be hypotension, where the blood pressure gets real low, or shock, or dysfunction of the heart, blood clots of the arteries or veins, or acute liver injury. The fourth criteria is laboratory evidence of severe inflammation. And the fifth criteria is absence of severe respiratory illness. So what happened was the CDC started getting all these case reports, and they reviewed 355 different publications to develop this new working definition of multisystem inflammatory syndrome in adults. Now, again, these patients have had minimal respiratory complications from COVID-19, just like as in children and adolescents. So far, 27 adults and 440 children have been reported to the CDC with this condition. And again, it is not known what causes this in either adults or children, but it's believed to represent post-infectious processes involving dysfunction or damage to the blood vessels, the clotting system, the inflammatory system, the dysregulation of the immune response system, dysfunction of the system that regulates and controls the blood pressure, and that's what's so far it seems to involved. Now, the timing between when you get this or when you're exposed to COVID-19 and the development of the syndrome is unclear. So again, as I've said many, many times, this COVID-19 disease is so new to the medical community. They're learning more and more about this all the time. The doctors are being alerted to this and educated and how to look for it, how to recognize it, and how to test for it, or what lab tests to order, and what treatment to do to treat these patients. Now, what is so sad to report is that for the adults who've been identified as having this multi-system inflammatory syndrome, all but one belong to a racial and ethnic minority group, with the largest number of these adults being African American. And we already know that long-standing health and social inequities have resulted in an increased risk of infection and severe outcomes from COVID-19 in communities of color. The same thing goes for children. This multisystem inflammatory syndrome in children has been disproportionately reported in African American and Hispanic children. Again, once this disease is recognized, it is possible that this demographic shift may change once more and more cases are reported. Now, the good news is that the majority of these adults and children have survived, but they require intensive care most of the time in tertiary healthcare settings. They require aggressive treatment most of the time with IV immune modulating drugs. Many have required intensive care with blood pressure support. Some have required invasive cardiac support. And I want to just emphasize this is a very critical complication of COVID-19 in adults, just as it is in children. Now, the recognition of yet another complication, another disorder associated with COVID-19 reinforces the need for prevention efforts to limit the spread of this SARS-CoV-2, this COVID-19 virus, and to limit this pandemic, especially in Black and brown communities of color. You know, what if somebody said there was a magic pill to prevent COVID-19? Would you take it? Now, I'm not talking about the vaccine, because polls have already demonstrated that African Americans in particular are hesitant to take this vaccine. While there is a magic pill, per se, and that's social distancing, facial mask wearing, and good hand hygiene, washing your hands. Right now, these are the only powerful magic pills that we have, folks. So use them. Use them all the time.
Use them whenever you have to leave your home. This is Dr. Rhonda Johnson. My views are my own. Stay safe, folks, and have a blessed day.